This program is brought to you by Newsworks in cooperation with the City of Eau Claire. This program is simulcast on WRFP-LP 101.9 FM.
We'll go ahead and call the City Council meeting to order. Please rise for the Pledge of Allegiance. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Madam City Clerk, please call the roll.
Councilmember Anderson. Here. Beaton. Berge. Here. Christofferson.
Here.
Emmanuel.
Here.
Gregert.
Here.
Klinkhammer.
Here.
Lohr.
Yep.
Weld.
Here.
Worthman.
Here. And good afternoon. Welcome to all of you joining us here in Chambers. And we want to, I guess, take this opportunity to update not only staff and each other, but the community. And with that, we'll look towards staff, and we'll start with City Manager Peters. Good evening.
Good evening, and thank you for being able to come and have an amended agenda on such short notice. As we looked at the topics for tonight, we wanted to start with a coronavirus update from our Health Department Director, Lisa Giese. We know that she's not here right now, so we'll modify the agenda just a little bit for that. But then also we would move from there to updating you on the response that we've had as a local government to this outbreak. And then Steve and I will talk with you about consideration of an emergency declaration resolution, and then provide opportunity and time for you to move to your agenda item, which had previously been scheduled, which is to review the RFPs for a consulting firm to assist with the city manager search. So if, perhaps until Lisa is able to join us, and I'm sure she's tied up. She's had an incredibly busy day, and we had just come from the press update that happened at 3:30, and so I'm sure she'll be here shortly. But we'll circle back to that if that's okay with you, and perhaps we'll spend just a little bit of time talking about really the update of where we're at and what we're doing. Local government, that's us. We are local government, and as all of you keenly are aware of, and yes, Emily, I'll make sure I look back to you, we provide the essential services which keep our community healthy and safe. And the community expects us to continue those services, especially during a time of emergency. And we've been spending a lot of time and effort over the last 3 weeks, and even before that, preparing and developing a response that allows us to be able to continue the essential services that the community expects. The situation is changing very quickly, incredibly quickly and rapidly. And just when we think that we have a sense of where it's at, it changes again. And it's going to test our ability to be flexible and resilient to maintain services. But I would like you and the community to hear that we are committed to maintaining those services for our community. So what I'd like to do is spend just a little bit of time and perhaps go through what we've been working on, what we've done, and what we're looking at going forward.
Mr. Peters,
yes.
Liska's here now.
Oh, hi. No worries. Would you like to provide your update? Sure. Okay. Because I know that Ms. Giese has many other obligations, and so we'll have her provide the update, and then if she needs to move on to some other things, she can. So with that, we will move to the just kind of the update of where we're at as a community with it. Just a little bit of perspective. This incident, we operate with an incident command system. It's a formal management structure that we use to manage incidents, and we look to the subject matter experts to lead us. And so whether it's a fire issue or a police issue, a flood, we look to different people to lead the response to that. In this case, of course, it's a health issue with COVID-19. And the health department is doing an incredibly good job of taking that lead with Marissa Stanley as the incident commander, and Liska is working as the liaison with a lot of public contact and providing a lot of information as we go forward, in addition to still being the director of the health department. So, Liska, thank you for coming tonight and providing an update.
First, my apologies for being late. I was trying to get an additional email out to some of our leadership. An enormous thanks to not only City Council for the work you do, but also really to the city leadership team. We are, I've said this over and over in the media, so you probably heard it way too much, but well, maybe not ever too much, but we are really fortunate in this community to have such amazing relationships and collaboration that happen. It doesn't happen in every community. We might think this is just the way things work everywhere, but it's not true. So we are very fortunate to have that, and certainly when we have times like this, it's even more important. We can't just be starting relationships when we're in a stressful time. I am not going to repeat all the updates that we're doing regularly now, but every day at 3:30 we are doing media briefings, and in those media briefings we are intending to provide an update on what is happening at that point in time, what we know at that point in time. I strongly encourage you to consider looking at those as a way to keep up to date. Our other primary source of information is our health department website, and we have a team that's really working hard to make sure that that's updated regularly, multiple times a day. We're also using social media platforms to push out information more quickly as well. We currently have no positive COVID-19 tests in Eau Claire County, so I will say that again, as of today, and the testing today, there are still no COVID-19 cases in Eau Claire County. We've tested more than 50 people. The testing is happened, not we personally, but in the community, Eau Claire County residents, we've had more than 50 people tested. Some of those tests are pending, but the ones that have come back have all been negative. We do have some people that are in self-quarantine. Again, quarantine is for people that are well but have had contact. We have no ill people that are currently being isolated because of COVID-19. We do have people that are at a higher risk level that we are watching regularly to see if they do end up with signs and symptoms of the disease, and those people would be promptly tested. We do know that there's community spread in the state now. Madison, Dane County, Kenosha County, and Milwaukee now have community spread of COVID-19. That means that people have positive cases that are not because of a known connection to somebody else that is positive. The state, because of that, has implemented over the course of the last number of days regular changes in the orders that are happening. We in Eau Claire are following all of those orders and all of the recommendations that exist. We are working with the state health department and Centers for Disease Control on moving this forward successfully in our community as far as preparing and responding. We have an amazing team, as Dale said. We have Incident Command that was stood up a number of weeks ago, I can't even remember now, but a while ago. It was very small initially. We now have a very large team that is doing work across the spectrum that you could imagine to try and come up with plans to respond and to be ready for the next phase. You may have seen today, for example, we stood up this morning a group that is working on childcare, and we've already had something posted on social media. So the teams are working very quickly to try and come up with some ways to support the community better. The governor did announce, if you did not hear, that as of today at 5 o'clock, any group larger than 10 that is meeting in a community needs to end with a number of exceptions. You are all one of them. We made sure that we asked the question about city council and county board, since both of those are meeting today. But both of those groups are exempt from that order. But it does mean that restaurants, bars, pretty much every other public space, the mall, movie theaters are all closed as of 5 o'clock today. It's a very extreme measure in the public health world. It's something that, very frankly, even those of us that have lots of education in public health have not seen in our careers. But it is something that the state at this point feels is important to minimize, at least in those areas where there's community transmission, the disease from being transmitted. Again, it's not, if this was just happening in Eau Claire, it would not be the recommended course of action, but because this is happening at a state level, we are making a decision at a state level to do this. The governor has done that. I think I'll stop there, and I can certainly, if the body is willing to have questions that are specific to incident command and response in the health department. I'm sorry, Dale, is that your intention? Okay, thank you. Do know we are working hard with partners, getting messages out in as many ways as we can. So for example, today when we heard the order change, all of our licensed establishments, bars, well, not bars because they're not licensed with us, but restaurants and any other kind of facility that we license immediately got a message. So those are the kinds of things that we're doing very proactively. Do know that, again, for example, today the media got the announcement from the governor before we did. So we are doing the very best we can in getting messaging out, but that's part of the challenge that we are experiencing. So I really appreciate the partners we work with. We are extremely fortunate that our incident commander is a master's prepared infectious disease epidemiologist. So we have the person in the right role in this community, and I don't know that there's another community, maybe Milwaukee, that has that, maybe Madison and Milwaukee. So we're very lucky to have Marissa on our team. So with that.
Questions? Councilmember Lahr.
When you mentioned about updating to the community, do you have any, the reason I ask, because we have Hmong, especially in the second group, are largely in this community, and we have the Spanish populations also. Do we have any language in Hmong, in Spanish out there that daily updates so they know instead of, putting English?
Yeah. Do you want me to repeat questions with the lack of microphones or not? Is that necessary? Okay, so the question is related to having materials and updates available in Hmong and Spanish, and I would say that that's a place we're struggling with right now, and we're trying to catch up with our public information team. We recognize it's an enormous issue. We have basic information available in both Hmong and Spanish, but we do not have our regular updates yet translated. We are working to provide that as part of our website application, and actually we can do that now on the website if you would like anything there translated. There are tools to do that, but we are working hard to try and figure that out. And we recognize that that's a need. We also recognize that there is a population that is undocumented and has particular needs, so we do have a team that's working on issues like that as well.
Any other questions? Councilmember Lahr. Sure.
When you mentioned about banning on an event that more than 10 people, especially the reason I asked, because this coming weekend we have a Hmong funeral.
Yeah,
in
we're
town.
aware of that.
So that's why I want to ask to make sure that I can get a wording to the Hmong community, say these have been banned to Governor Eagle, and this is affecting funeral home too, or?
Yeah. Yeah, the question about funeral homes, I actually asked that on the state call immediately after the order was put forward. We did also hear from somebody in the community about this specific event in Eau Claire. I have not yet gotten an answer on funerals. It was not on the exempted list. Our understanding at this point in time is that that would be considered an event that would not be allowed, unfortunately, and we understand that that's an enormous impact to families during an already stressful time. So we will be hopefully getting a concrete response on that, but that question was forwarded to the state, to the governor's team, and it's not yet responded to unless it's happened since I've been working on email and coming over here.
Thank you.
Yeah.
Any other question? Councilmember Beaton.
I've got some questions from our local business community and some guidance of whether they should be shutting down or not. Given the governor's order today, is it just assumed that all businesses should be shut down unless the ones that have been explicitly named?
Yeah, the question is what should shut down. So there is some very specific guidance in the order about what is allowed to stay open and everything else is presumed to be closed. It is an order, not a recommendation, so we are obligated in this community to also follow that order. And I think one of the things that could be considered and should be considered by businesses is that if there's a way to conduct the business where there's storefront open, but like the restaurant order where takeout can happen, that's certainly permissible. The risk is multiple people sharing close space, and that's the prevention. That's the prevention tool that's being used right now. So if there's a creative way people can think about their operations where there wouldn't be more than 10 people in a space at a time, it would be allowable to continue. If that, and I know that's a bit maybe even more complicated, but that is our encouragement is for businesses to think creatively about that. It's not that every building has to close. If there are creative solutions, that's absolutely allowable. We have been working closely with the chamber. I did have a phone conference with Dave Miner today. We're talking again tomorrow. We are communicating. Again, health department and most of us don't have broad group lists of every business, so we're counting on all of you as you get updates to share those, but we are doing our best to get the message out, but I'm sure that there will remain to be questions.
Certainly.
So I did listen to your press conference today, and you addressed enforcement of that order. I think that's something that's a lot of people are wondering, so I'm wondering if you can repeat that here.
Yeah. The question about enforcement was asked during the news conference, and again, health department will be working with legal counsel at the city and the county around enforcement. Our intention at this point, because it's a active situation, is that we will not be sending anybody out to check to see if, for example, a restaurant is open, but certainly if we get complaints. It's an important public health measure, and we definitely are taking it seriously. Did you have some additional comment, Steve, that you wanted to make? But
yeah, I just wanted to make sure that we weren't overly expansive.
Yeah.
I heard your question, right, Councilmember Beaton, you said business, right?
Mm-hmm.
And so there are a number of forms of business that are expressly
exempt.
And, so they include child care facilities, hotels and motels, retail establishments,
Yeah.
although
all
as
of the
Ms.
exempt.
Nancy was indicating, unless there's such a congregation of people and it expressly says, such as malls, then malls shall expressly shut down. But otherwise, retail establishments, including gas stations, auto repair facilities, are able, but they have to keep in mind the concept of this general kind of spacing that's now being encouraged.
Right.
Other types of business that are exempted, healthcare, specifically for facilities for voting. All governmental facilities are exempted, but again, as we approach a primary election and the spring nonpartisan election, those are on until further notice. And then, Ms. Giese already touched on food establishments. So in-house, on-site, prohibited and closed, but takeout
as possible. And I think just to be clear, the last, and I think maybe the largest group of businesses we have are office kinds of businesses. So number 12 in the order very explicitly says office spaces are exempt. And it does say such facilities shall implement social distancing, including teleworking as much as possible. It also exempts manufacturing, processing, distribution, and production facilities, job centers, utility facilities. So there are a lot of places that are exempt, and I think it's important for all of us to make sure that the headline is different than the detail, and as much as we can encourage questions about it. Again, our 839-4725 number is the number we are asking. If people have questions, we're asking first to read things like the order, and then if there are questions, please let us know. We will presume positive intent in this community. We will certainly inform and talk through with people if it appears that they are violating the order as a first step and not assume they're doing it on purpose. But again, there are a lot of exceptions. The idea is to create some distance in some of our spaces. So,
any other questions? Councilmember Gregor.
Yeah, thank you. Thank you so much for all of your work, Liska. I guess this is a question that has multiple parts that I feel like we've been getting consistent answers about, but I think it's worth repeating that. So if someone, at what point does someone, should someone seek a test, and at what point should they not? And then also, like, how would they go about seeking a test?
Sure. Yeah, I think there's a fair amount of confusion. There also was a recent change today in that communication from the state. So the communication all along is that our healthcare resources are limited. Excuse me. I clearly have been talking too much. Our healthcare resources are limited, and the limited resources do mean we need to prioritize. So all along we've been communicating clearly, and the state has been communicating clearly that testing is not for well people, testing is not for people that have a sniffle, testing is not in situations where people are worried something's happening. Even if they've been in contact with a COVID-19 positive person or they've been in an area where there's spread of COVID-19, people should not be tested unless there are significant symptoms. People also are being tested if they are hospitalized or if they are healthcare workers. So the new recommendation from the State Lab of Hygiene in the state was that the prioritization of testing starting now is related to hospitalized patients and patients that are people that are healthcare workers will get prioritized testing, so we get those done more quickly. The reason for that is we want to make sure that hospitalized people have the right treatment quickly, so we can make sure that they have the best chance of survival, frankly. And healthcare workers are the riskiest people to spread disease because they work with a vulnerable population. So those two populations will be prioritized. I think the additional question is, how do you get a test if you are in those situations? The communication has been that if people are ill with significant flu-like symptoms, so again, fever, cough, headache, congestion, those significant flu-like symptoms, that they call their healthcare provider, not go into the emergency room, and again, unless it's clearly emergency, they can't breathe, but that if they have significant flu-like symptoms, they call their healthcare provider, and their healthcare provider will work through with them to problem solve whether they need a test or not. It may be that they don't need a test and that they just need to stay home until they're well. And I think the community has to be, frankly, satisfied with that conclusion. We are hearing individuals and employers that just say, you've got to get a test, or we can't, whatever. And that really can't be happening now. It's stressing our system too much, and it's not going to help us in the long run. We know there's COVID-19 broadly in Wisconsin, so those people that are very ill and those people that are healthcare workers are our priority right now. We do have testing available in Eau Claire. That's also been a question that I've regularly gotten. The collection of the test is a swab, and if any of you have had a nasopharyngeal swab, which is the technical word, it's down your nose and in the back of your throat, swab to get a sample. That sample, once it's collected, is sent to a lab, and the labs that we have available are growing in the state, but right now, State Lab of Hygiene in Madison, the Milwaukee lab, and some private labs are the ones doing the testing. Mayo has testing available at Rochester, so they are newly this week sending their test to Rochester, but those things are constantly changing. But we do have the ability to run the test, and we have testing happening, the swabbing happening in Eau Claire. Does that, yeah, give you? Okay.
Councilmember Orthman.
Thank you, Council President. Ms. Kesey, thank you for all of your work and leadership. Question about folks in our community who may be experiencing homelessness. I apologize. I have seen the press conference, but I haven't seen it today. So if you brought that up, my apologies. But is there some discussion about what's going on with vulnerable populations such as?
Yeah, absolutely. So people experiencing homelessness are one of our priority populations. We have a branch of our incident command that is working on that now. Tomorrow, the Dairyland Coalition, which is the group of partners that gets together, and it's a multi-county group, but they meet typically here in Eau Claire, are getting together. We're bringing an update to them, and we are working with that group as well as a core group of partners in this community on their continuity of operations plans and on what happens when they have someone that is positive. We haven't yet identified a specific location for individuals that are positive for COVID-19 but not needing medical care, needing to be hospitalized, but we have a number of options, and like we do for other diseases, tuberculosis would be a classic example where we have to have someone be elsewhere. We have options available to us. There is a team working on that right now, and while it is a challenging situation, and the people that are working in those systems are very stressed right now about it, we are working with them, and I'm confident that as we need to respond, we will be doing that. The state indicated this afternoon that they will have state guidance for homeless shelters available soon. That was in there. They send to us an update every day, and it was in their update today, which has typically meant that tonight or tomorrow we would get something, so I'm anticipating that as well.
Council Vice President Emanuel.
Thank you, Council President Weld. Thank you, Ms. Giese, so much for your leadership. My understanding is it's very likely that most communities in Wisconsin will be touched by this at some point in time. And depending on the action council takes today, we may not see each other in person again if and when COVID-19 comes to our community. As elected leaders, do you have a message or any recommendations of how we can support your work when people ask us questions? We certainly are not the subject matter experts on this, and so how can we complement and support the work that the team that you're working with is doing?
Sure. Thanks for the question. Yes, I expect COVID-19 to come to this community. We shouldn't have probably a different expectation. I think at this point we don't have natural immunity to the disease. It is in the state. There's a high likelihood that it will come here as well. I think our job once the disease comes here, both elected officials and all of us that are working in incident command right now, is to really minimize the impact of the disease. Many people hear about flattening the curve. The idea actually of flattening the curve is it's not what we're doing right now. It's flattening the curve once disease arrives. And we don't have disease right now, so you may have heard me say things like that. But it's the idea once we have disease that we have the fewest people have to seek health care at the same time. We still likely will have the same number of people infected, but the ability to treat people that are infected, especially those that are most impacted, is hugely impacted about how many show up at the door of the emergency room at the same time. So helping with that, people understanding that message, I think is important for elected officials to help us with that. Following our website, if you're a social media person, following social media and encouraging your constituents to do that. We certainly want to answer your questions, and if you have questions and I have not looked at my email for a while, please call that 839-4725 number and just identify yourself as an elected official, and someone is monitoring those lines constantly and we will get back to you. I think also my ask to all of you is assume positive intent. Everybody on the incident command team is working as hard as they can. Everybody at the city is working as hard as they can to respond. This is really unprecedented work. We certainly know communicable disease work like this, but this is at a scale that is significantly different. So that would be another ask, but I think continuing to push people to those places that we already have information so we are not tasked with coming up with additional information would be hugely helpful.
Councilmember Orthman.
Thank you, Council President. Ms. Giese, as you know, this evening we're going to be voting on this resolution declaring emergency measures can be taken. And I just wanted to get your perspective. I mean, one of the things that I keep hearing in the national media and news is that if the curve isn't flattened and we have a lot of cases that healthcare facilities may be overrun, we're lucky that we have the number that we have in this community, but I imagine that there isn't a lot of excess capacity to be able to handle if we have a lot of cases of people needing treatment. And is it your opinion that this resolution really helps if our local government has to take action, spend dollars, help the healthcare system? Is this giving that power? And is this that strength that we need to be able to respond?
So, the strength that we have to respond in our current environment and in any emergency, whether it's a large fire or a large tornado, really is using our incident command system and then using the tools that we have in the toolbox to really make sure that we can make decisions quickly and effectively. So I think the declaration today is an opportunity to give some flexibility and nimbleness to the team from the city government side to respond to needs, whether that's financial needs, whether that's limited ordinance change needs, whether that's the things that city government does, your basic operations, anything about that would help support incident command and getting the work done. I think that's important. So I believe that the declaration as written and working with the legal team here and both with the County of Eau Claire doing that in tandem today really gives that multi-pronged approach that county resources can be brought to bear quickly and city resources from Altoona and Eau Claire can be brought to bear quickly and creatively, frankly, and nimbly, given that we aren't sure where this is going to go. From a resource standpoint, very frankly, it's not always the money that we need, it's the people and the immediacy of decision making about prioritizing if we get to that point. At some point, we'll need to have money to support how do we backfill all the time. But I think my biggest priority from a public health standpoint is that I know that if I call Dale and we need something for incident command, that he's able to respond.
Thank you.
Yeah.
Any other questions for Ms. Giese? I don't think he...
Yeah. Thank you very much. And again, thank you, a huge thank you to to Dale and his team for the partnership work. It makes an enormous difference.
Thank you
So.
for everything. Yeah.
All right.
Thank you.
Thank you. And again, I would echo and just reinforce the level of communication and cooperation that is happening in this community is really unheard of in a lot of other places. And when we get to the resolution, the idea that the city and the county and a neighboring city all together within, really a matter of 2 days was able to have a consistent and consolidated message about how we're going to work together. The county administrator and myself and the city administrator of the City of Altoona are regularly in communication, so we're trying to have a lot of similar responses at the local government level because there's already enough confusion that's happening. We don't need to have different confusion between what's happening at the different local levels of government. So with that, what I'd like to do is just talk a little bit about really what we've done. I know it's not the fanciest PowerPoint that you've ever seen from me, but it's what you get today. So just talking a little bit about what we've done and maybe where we're going, and then give you an opportunity to ask some questions, and then we'll move on to the resolution before you. Certainly, we've been working again for quite some time in just having plans in place for emergencies and contingencies. We do have the incident command system, which has been referenced several times. That was put in place probably well over 2 months or more, and that's a very structured command structure that works with the people who have the expertise to get the work done, which isn't always necessarily the chain of command that you would normally have. And so we've worked and trained well to be able to have people fall into place and do what they need to do to support the best efforts to managing it, and we have that going. We do have a public information branch of that, which is really ramping up right now. And one of the things I wanted to talk about was getting answers, but that's already been there, and Ms. Giesi's been able to talk about that. But please, to the extent that you get questions, you need answers, you can call the health department. You can certainly email me, and I will pass that along. But the information, we are now on daily updates, and those updates are streamed live, and they're also on the website. And so, and we're putting more and more information on the website all the time in terms of answers. And again, as Ms. Giesi pointed out, this is changing so quickly. What we thought was the answer yesterday is a different answer today, and everybody is working in good faith really hard to stay ahead of that, and it's just constantly changing. So the best source of information is the website, or contacting myself and the health department directly through their phone number, and we'll get you the answers that you need. But first, try to get them, and be consistent. We prefer that you actually refer them to a document or something that we have rather than trying to answer it yourself, because there can always be some subtleties with how that's answered. So, when in doubt, you can help us a lot by just referring people to the sources, and that source is being updated. It is the website, it is the Facebook page, and it is the daily updates that are happening at 3:30. In terms of continuing operations, or it's called a COOP, and we've been doing a lot of that. We've had the senior staff group getting together and talking about how they're going to do that, and we're looking at the essential functions of our organization. We are not going to be closing down. We will be continuing service as best as we can, and we think we've got some good plans and backup plans in place to do that. Some of this involves, in many of the departments, actually meeting with each employee and trying to understand what their needs are, and where they're at, and how we can work with them in their personal life. We recognize that every one of our public servants has a personal life, and that can tug really, really hard on your ability to do your public service. And so we are working very diligently with our employees. In all of this, the key is flexibility, and working with people. We have really good public servants that want to do the right thing and serve their community. We have to help them be able to be successful in their home life as well. And so all of the policies and procedures that we're putting in place revolve around flexibility and being able to adapt and do things that can work for the employees so that they can work to serve the public. To that end, we've been looking and revising quite a few of our personnel policies, principally working at home. Working at home or remotely has not been something that the City of Eau Claire has done in any really significant way. Our work out at the Raft, when we were out in Prairie Lane, it helped us actually quite a bit. We did tremendous work before we went out to Prairie Lane in terms of having electronic filing, being able to shift away from paper, have access to that electronic filing, and to put services online. We're able to take that work and where it was a year ago, and we're really ramping that up quite a bit. So we have, just in the last 4 days, we have created up to 200, they're called VPNs, or virtual private networks, which are going to allow almost half of our workforce to be able to work from home and be able to conduct their work. And so we're doing that, and also, again, by working with individual employees, working to look to adjust work schedules. So a very small example, but perhaps it's somebody who works in the parks or the streets, and they have a childcare need during the day, but they can work in the evening. So maybe we assign them different work that they can do in the evening, and have that flexibility. And or what could you do at home for quite a few of our. So a lot of emphasis. We are trying that out. We're doing testing. We'll be running our first payroll totally remotely this week, and as well as all of our other significant administrative functions. So we're testing a lot of work out for at home, adjusting work schedules, a lot of reassignments, and working with people individually to offer flexibility. And then we've also been updating our leave policies to address. Who knew we'd have to try to decide how we would pay people if they're quarantined, or if they're isolated, and how that works. And so, we've been, guidance actually went out today on how that works. We had travel policy yesterday. I would have said I know what the travel policy is going to be, and it relates to community spread, and don't go where there's community spread. Well, now the state of Wisconsin's been determined to have community spread, so we are really restricting the travel from a business-related perspective, and encouraging our employees to find alternative ways to get the information that they need rather than traveling in person. And we're certainly encouraging people not to travel for personal reasons as well, although we recognize we have employees that have been on vacation and they're just getting back, and through no fault of their own, they find themselves now needing to address that they came from a country that perhaps was a level 2 or level 3 or had community spread, and we're working with them and allowing them to use their sick leave in that time of an ordered quarantine, or if they're sick, isolation, which we don't have any that are in that status, but we're prepared to be responsive to that if we do. We've been working to message with our employees to protect yourself. If you're sick, stay home. We really don't want you coming to the workplace. Wash your hands, of course, the cleaning and sneezing etiquette, and we've really ramped up our cleaning and disinfecting regiment. We're reviewing our supplies and inventory for personal protection, and we are tracking as much of this as we can financially, because there are going to be grants, there's going to be programs that put in place, and we want to be able to capture any reimbursements that might be possible when we, as we go forward with this. In terms of individual departments, I thought I'll try to strike a balance of not too much detail, but to give you a little bit of perspective of some of the things we're doing within some of our core services to have continuation of operations, and also just the changing of a workplace. And so, in police, for example, they've suspended the briefings. So you would have have an entire work group come in and get a briefing, and that's now being done remotely. Our records employees are going home and trying to be able to do that basically from home. We are training and working to have backup employees for the 911 center. So, again, that might be one of those accommodations where you might have a protective service employee that used to be in the communication center. They have that skill. They now find themselves, with it, where we need to have an alternate schedule, and we can slide them in, to that if we need to. So So, quite a bit of work is being done there to make sure that we have continuity with the police officers, talking about our procedures and how we're going to enter homes if we have to, or if we have to, with traffic stops and things like that. Fire is a lot of parallel there. Again, we're working with each fire employee one-on-one to understand their needs. It's really uplifting that in many of our employee communities, they're talking amongst themselves and trying to figure this out. And they're saying, hey, I have a child care need, or I can't be here. And so can another family within that family of workers help each other out? And so there's a lot of really cooperative and uplifting work that's happening amongst our employees so that they can be available, to serve our community, and that they can help each other out. So that's happening in particularly those core services where they just have to continue, like police and fire. In community services, just something I think that is worth pointing out, and I don't mean to be redundant about it, but our water is safe. And for the public, I want you to hear that. Our water is safe. And we will continue to have water in our system. We have a highly automated water plant. We have, how many operators, Jeff? 7. We have 7 operators, but it can be operated with 1 if we really have to. So there's a lot of depth to be able to keep our water system operating and running. It is disinfected, and the virus cannot be transmitted through the water. So it's really important that people understand that our water system is safe, and it's going to continue to be there. It will be reliable, and it will be available for the community. Our sewer service as well. I mean, it's one thing to have the water come in your house, you need it to leave your house. And the wastewater treatment plant can be totally run, fully automated, although there is a crew of people that are there, and we have a lot of depth within that crew. And quite frankly, we have employees that were at either of those plants that maybe have transferred out at different times, or have the certifications, or at least the training, that maybe they're in parks or streets. And that's all part of this cross-training and the backup that we're going to have there. And I put streets and parks down there, and because we might not think of them as essential, but I think we're going to find that those employees are going to be filling in a lot of gaps in different places. You'll see when I talk about elections, we're going to be training people in our parks and streets department to do elections, because we think that with the population of I'm jumping ahead, but they can help out there. They can help out. We have CDL drivers, and we'll talk about transit, but we want to keep the transit system operating. But if we lose transit drivers, we can take some of our other CDL drivers, and with training that we are working on, we can get them their P or their passenger endorsement and get more depth and backup for our transit system. So these streets and parks employees are going to be filling in, helping out with the cleaning of the buildings, in addition to if we do have a March snowstorm, which isn't unheard of, that we'll be able to get the streets cleared. Our park pavilions and restrooms and areas are likely going to be delayed in being opened up, but we'll get to that when we can. A little bit about transit. I mentioned we have taken an approach that transit is an essential service, particularly for a key group an important group of people in our community that need it for transportation. And we are exploring ways to be able to keep the buses running, protect the employees, and have the social distancing that it would be appropriate within the transit system. So we're not ordered to turn off the public transit. I suppose that could happen, and we would have to follow that. But pending that, please know that it is our intent to keep the transit system running as long as we can safely for the employees and also for the patrons that are there. To that, for example, the resolution that you have before you. One of the things that might happen there is we might need to suspend fares, or we won't collect the fares. It may be a volunteer fare or something like that, and we segregate the driver from the passengers. But those are the kinds of things that we may need to do to be flexible and be able to keep services available that for certain members of our community are it's a really important service. And so I want you to know that it's one that we have placed as a high priority in doing all we can to keep it going. Community development. The plans and our ability for developers to submit their plans online is really close to being able to go live. We're talking about being flexible in the way people have inspections done. Perhaps they can send pictures in, and our inspectors can review them at home and provide approvals for that. So we're looking at ways in which we can still provide those services from a community development program online. Engineering, it might not seem like a big deal, but the stoplights need to keep working and the streetlights need to keep working. And so we have many of our stoplights and systems can be worked remotely, and we're making sure that those can be operated remotely, and that we have some depth in the people that can operate them and control them and reset them. So you have a lightning strike that turns them off and they all start blinking red. We got to be able to reset them and turn them on. And so we're intentionally thinking about that traffic system and how we can have depth and people that can do that remotely. And then we just have the administrative staff on the support, because all of this can't happen if we don't get a payroll out, we can't buy stuff, and have the other administrative support. And so finance is working very hard to be able to do as much as we can online, be able to get people to be so that they can pay their bills and have their interaction with us online, and then IT, as I mentioned, is really on the front lines of this in terms of having the virtual networks available for our employees. And when we talk about meetings, we'll talk about what we might be wanting to do there. And then there's elections. We consider elections to be one of the primary roles of local government. I mean, it's an incredibly important role and responsibility that we have. We are planning to have elections. And until we're told that we won't have elections, which is a possibility. That is a determination that will come from the state. It's not a local determination, but we're going to be promoting heavily people being able to do absentee voting. And we're already getting a lot of requests for those, so we're putting resources into being able to respond to and address the absentee ballots. And again, we're talking about being able to train people that can backfill perhaps the usual election staff that might not be as fully there for us. We're hopeful that they are, but we're anticipating that we might have some people that say that that's just they're not able to be there this year. And so we'll be training people for that, as well as looking at the physical location of and layout of the election sites, so that we can have that spatial distancing as much as we can. So know that we've, for several weeks now, we've been thinking about how do we conduct these elections so that it's safe for the workers. We have enough workers. There's integrity to the election, and we provide whatever protection we can to the people that are participating in the election. So stay tuned, and we'll have more updates on that. Maybe before I talk about some of the things we're doing going forward, any questions on the continuity of service and kind of some of the things? Yes, Councilmember. I'm sorry.
Thank you, Council President. One thing, I have two questions actually. Mm-hmm. First, I assume that you've already thought about this, because
okay.
But the potential of having a flood mm-hmm. response. Mm-hmm. How is that looking, and are we still set up to do all the things that we need to do if that's another challenge?
Yes. So we are set up. The flood risk is going down every day. We had fairly highly saturated soils, which was the concern. The soil saturation is still above normal. Mm-hmm. So we have the risk of the spring flooding related to the melting of snow has gone down, dramatically. The risk of a very heavy rain event that would happen, to the north and east of us into the Chippewa River Basin is still there. And so But unless we were to have, a very significant and perhaps even prolonged rain event, I would not anticipate that flooding is going to be an issue for us this spring, or at least a significant issue.
Mm-hmm.
Maybe we might have to put trails, close some trails and things like that. But that, that's still subject to change and what would happen. But we have our plugs in place, our plan is in place.
Mm-hmm.
We have the personnel available to handle and respond to the flood.
And a follow-up, thanks for that. A follow-up regarding the absentee voting.
Yes.
I went online and signed up for an absentee today. It says that you have to upload your ID card.
If you haven't previously registered?
Yeah, but it says, it's not on file locally. So that's what I was wondering is, I voted numerous times, many, many times at my location with my ID. I would have thought that, that wouldn't have to be an extra step that people would have to go through, so.
Maybe I'd ask our city clerk, Ms. Riepel, to respond to that.
So if you have not received an absentee ballot by mail prior in the city of Eau Claire, it is required that you submit a photo ID for an absentee ballot request.
Okay.
The one exception is if voters are choosing the indefinitely confined option, they do not need to upload the photo ID. So those people that say they're indefinitely confined and want ballots mailed to them from here on out, they don't need to upload that photo ID.
Okay, thanks.
Thank you. Other questions just on the continuing operations piece of it?
Any other questions from Council? Council Vice President Emmanuel.
Thank you, Council President Weld. I do have a question around employee leaves policy.
Yes.
Would this be the time to ask?
Sure.
Okay. So I'm curious about if there will be additional provisions that are created in this emergency situation, such as allowing people to accrue a negative leave balance or a COVID-19 related leave balance that could be applied for child care, caring for yourself, needing to be quarantined, et cetera. So that's part one of what types of leaves may be created. And two, in a creation of leaves, I'm really concerned about the people who don't currently qualify for our current leave policy. That may be in other circumstances, that may be okay, but I don't want anybody in our city being inadvertently penalized for working in our city during a time of global pandemic. So how do we take care of perhaps employees who are not covered by leave provisions?
Yep. So to the first one, yes, we are making some provisions for negative leave balances that could then be made up, with time after, you're able to work. And so that is a change that we're providing and adding. In terms of the leave balances or the qualifications, to the extent that there were or there are, like the most basic one is FMLA, right? You're supposed to work a year before you can get FMLA, and we're going to waive that and basically presume that if you're an employee and you've only been here a day, that requirement that's there in state or federal law that you have to wait a certain time before you get that, we're going to waive that, and basically we're going to presume that you have qualified for that leave. In terms of providing leave benefits to all of our benefits are accrued, per se. We really don't have, our regular employees, either full-time or part-time, receive leave benefits. And so I guess the population that doesn't have a leave benefit are temporary employees, like a Parks and Recreation employee. Our election workers, for example, that come in don't get a leave benefit. And so we're not contemplating, like for example, for election workers, if an election worker would have normally come in and doesn't come in, there's not a leave benefit for them, for not coming in. But for all of our regular employees who have leave benefits, we are taking a very generous interpretation of the qualification, and then we are also allowing for some negative balance accrual.
Certainly.
Okay, thank you. Thank you for that information. Aside from folks who may be doing summer lifeguarding, which I hope we get to do this year,
yes,
and folks who are, maybe high schoolers who are working and selling,
concessions at
Concessions,
Hobbs or something
exactly,
like
yeah,
that.
and do we have any employees that don't fit in that category that have been brought on for, let's say, 9 months of LTE work, who would not qualify as of today for leave benefits? And I don't need that answer now.
I'd have to look at that, but if we do, it's very, very, very few.
Okay. So then the other question is I guess the other follow-up is, for these leave provisions, is that something that the administrator has authority over creating, or is that something that you would bring back to council for approval of, let's say, the negative leave balance?
So all of them have they're all all of them are within the administrative authority, except for one, which if you pass the resolution, I would have the authority to do, and that is when somebody has exhausted all of their leave balances, and I guess even if you have a status of leave without pay, the rule had been that you basically then have to pay all of your benefits, because, and we're going to waive that and basically say if you find yourself in a situation where there's actually, you're on leave without pay, or we're granting that, we'll continue your leave benefits, or your health benefits at the same contribution. The employer contribution would continue, because normally with a leave without pay status, the employer contribution towards the health insurance would stop, but we're going to continue that if somebody finds themselves in that status.
Just one last question.
Certainly.
Thank you. As you can hear from my questions, this is something I'm deeply concerned about. I think that, unfortunately, this pandemic is going to cause some significant economic hardships, even for people in the middle class who maybe even had a safety net. And so I'm wondering about how and when can our council talk as a body about maybe coming up with an additional leave provision that's a catastrophic leave provision that is very generous to employees, so they have an additional peace of mind. For example, a negative leave balance, while it serves its purpose long term, if something else comes up and they're already operating at a negative leave balance, that could be additional peril for that individual. So
Sure.
I would really like to have an opportunity to explore from a policy perspective, how do we ensure the utmost support, especially because the work for these employees has already been budgeted. This is not an additional budgetary increase. It's paying for work or paying for the employee, even if they're not able to do the work, but just to take care of them.
Our primary, I guess, focus is to try to find ways that we can work with them so that they can still work, because we have to get the work done. And so, between the flexibility options that we have, working at home, we don't have a sense at this point of really how many people are going to find themselves, with a need for a leave, situation. We really don't know, because we're working through and trying to have employees be able to still function and still work and provide service to the community. So we don't know how many employees will actually find themselves in a situation where they just simply can't work, and that they wouldn't have a leave, or that they don't have enough leave balance, because we have very generous sick leave and vacation leave benefits and holiday benefits. So at this point, we really don't know, again, where people are going to find themselves, or where we're going to find ourselves. That's why we're meeting with so many of the employees one-on-one to try to get a sense of, how's this going to work for you, how's this going to work for us, and be able to continue the service. I will certainly be able to provide updates and provide information, and as appropriate, we can have that conversation about if there's extensions or broadening. It's still very much emerging. There's federal legislation that may impact all of this. We don't know the impact of that federal legislation, what that means for us, what it means for employees, what it means, from an administrator's perspective. So You know, I guess what I can tell you is that we are, you know, we're taking a very generous interpretation within the leave benefits that we have to facilitate, you know, the needs of the employees, and then also working with the employees and to have them work with us to have as much, you know, ability to get the work done as we can with the flexibility and the changing of schedules. So that's where we're at today. And it's changing every day. So, I mean, the policies, they're just going out today. I mean, that we're updating them, and I suspect that they will change as we just learn more about how to, you know, we are not a business that can just shut down and then decide how we want to, you know, pay our employees not to work. I mean, we have to figure out how to still continue these essential services. And that's our primary goal in a way that can still work for the families that, you know, are dedicating themselves to the public service. And that is going to be an evolving and changing situation. But know that we're committed to working with our employees, and they're committed to working with us to still provide these services.
Councilman McGregor.
Yeah, thank you, President Weld. I guess my question's in the community development arena on there, and that's that's surrounding the census, where April 1st is essentially the snapshot we're looking at, and now
we're into it now.
Yeah, and so like people got in the mail on Saturday their census forms, but around that time and since that time we've had thousands of people, mostly students, leave town. So I guess I'm wondering how we address that and make sure that those people are counted. Or
I see that Mr. Ivory has joined us because Scott was not able to be here tonight. Could you be able to address that?
Mr. Ivory.
Good evening. I've been in contact with our local census representative, and she has been in contact with the officials over at UW Eau Claire, and they're trying to work out that situation right now. So as Dale mentioned, things are kind of changing daily on that, but they are on top of that and trying to figure out how to make sure that those students are counted, because some are still in town, but some have gone back to their hometown. So we're aware of that issue, and we're trying to resolve that.
Thank you, Mr. Ivory. Any other questions in regards to operations?
Okay, then just a little bit about some of the things that we're going forward. Certainly next on your agenda is consideration of the emergency declaration, and we'll talk more specifically about that in just a minute. Again, our commitment to the employees, working together, providing that flexibility, and being able to continue the operations for the organization. We're implementing our contingency plans to be able to continue those essential services. We want to continue to support the incident command structure and work with the health department with their updates and make sure that we're following and being consistent with their guidelines. That's been a very important I guess, principle for me to make sure that we are in line with the incident command system. That we're developing alternate methods for meetings, and let's talk a little bit about that as it relates to you. There was recent guidance that came out from the AG that provided for more flexibility in terms of being able to have remote meetings. The resolution that you have for the declaration of emergency will allow that to happen. We still have to figure out what the technology for that is going to look like. The original, I guess, interpretation contemplated council members, a few council members not being able to make a meeting, and they'd be able to, basically electronically come in. But it kind of it assumed that there was still a physical space, there was still a staff presentation, the public could still come in, the public could still, talk. Now to take that to another level where you have a public meeting that is really entirely in that virtual space, because if it's appropriate for the council not to be in the space, then it's probably appropriate for the staff not to be here or for the public to be here. So you have to figure out how to put the whole thing into a virtual space. So we are exploring that and looking at that, and I know we're not alone in trying to figure that out, but that's certainly what we're trying to work through is how can we have a meeting that is legal, is transparent, that allows for the public input, or certainly the public observation of what's happening, and that. So we're also looking at the agendas and pushing off things that certainly that we think might generate more of a public interest in terms of input, and or things that just really we can postpone and conduct that business later. So trying to simplify the agendas and then figure out how we can get them online, because at some point, I mean, we'll have to decide, even though we're exempt from that 10 person limit to have our meetings, do we still want to do that? And so do you just not have the meeting versus going to this online session? So that's something that Council President Weld and I will be in constant communication and evaluating and determining, as well as looking at what would be on the agenda for the needs. Going forward, the communication with the employees and the council, very, very important. So certainly know that I am committed to keeping you informed and having communication with what's happening outside of even the official stuff that's in the incident command, but just giving you perspectives on some things. And it's also important that there's communication with the employees. We have over 500 employees. They need to have a sense of what's happening and how we're how things are working. And so it's an imperfect and with the balls in the air. There can certainly always be more of it, but just know that is a key bullet point for us to have that communication. And then assisting the community with the impacts of social isolation. So I wanted to put that one on just to have the conversation that, that's a new role for us, is to try to figure out how to help the community. I mean, what can we do to help the community with the downside of social isolation? And I don't know what those answers are, and I don't know necessarily what that looks like in terms of how we address that. But I just wanted you to be aware that we know that the first few days, the first week, that's one. But if this goes on, that's going to bring its own stresses. And what can we do to help the community with those negative impacts of prolonged social isolation, and then facilitating those remote meetings. I guess that's kind of duplicative of the developing alternate methods for meetings. So that's, at least today, kind of the list of things that we're working on. And I guess at this point, I'd be open to any questions that you would have related to this before we would then move on to the consideration of the resolution.
Councilmember Beaton. Councilmember Anderson.
Thank you. We have, there's no one person that's making this happen. I mean, the cooperation and the teamwork and the attitude and approach that is at all levels of this organization to figure out how to continue services is really impressive. And I can speak for all of the management team that we're just really proud of the people we get to work with.
Councilmember Beat.
Now I kind of wish you would have waited. But I echo Councilmember Anderson's sentiment. I think everyone's doing a great job, and we're especially lucky to have your leadership deal, your decades of experience, and feel grateful that you have us all in our community in mind.
Oh, well, thank you. That's very kind. But again, it is a team effort, and there's just a lot of people that are pulling together to make this work as perfectly or imperfectly as it's going to seem, and the bumps in the roads. And I would express just a great appreciation for the deference and support that I've been feeling from the council to it's not perfect, right? The communication is not perfect. What we're doing is, we're figuring this out as we go. This is incredibly unprecedented times, and it involves an unprecedented response. And so, really appreciate your flexibility in how we approach this and work through it. So, thank you.
Any other questions?
I did have a question.
Certainly.
Sorry. So in terms of in-person meetings, should we be expecting to meet next week as originally scheduled?
So at this point, I would say stay tuned. Councilmember Weld and I, and because of all the other events that happened today, we haven't been through that agenda. I think some of that's going to depend on, quite frankly, working with Ms. Giese, and if we actually have, I mean, maybe if there is a, kind of we got to see where the community is at, and the comfort level, even though we can meet, you know, is that something we want to do? And so, you know, I'll be working closely, you know, with the incident command, and we'll be, you know, evaluating that. So at this point, that decision hasn't been made. There are other, you know, boards or commissions that we are looking at, you know, canceling or, you know, or delaying. But at this point, I think as Ms. Giese pointed out, all of this is preparing us to be able to function effectively when, you know, and I agree, it's probably not if, but when it arrives in the community, that we're able to very quickly, you know, move to, you know, to the measures that are needed to then, you know, flatten that curve. And so that is changing every day. And so I would say that's going to be on a case-by-case basis. You know, certainly by next week, we're not going to have the technology to, you know, to have an electronic meeting. So if we want to have the business take place, it will likely need to be, you know, face-to-face. But it may mean we also end up canceling it as well. So I wish I had a better answer for you, but even just how the world has changed from yesterday to today, and next Monday seems like a long ways off at this point.
Council Vice President Emanuel.
Thank you, Council President Weld. I just have a comment in regards to the ongoing interpretation from the Attorney General on the open meetings and how we might facilitate that. If it turns out in that interpretation that you need at least a small group of people to offset the number of folks who are online, I live very close, just a bridge away. So I'm happy to be one of the designees to come down in person if that's needed.
Thank you. That's much appreciated.
Any other questions before we move on to the?
Okay.
No?
Then thank you. Then the next item is the consideration of the resolution. At this point, I'd like to turn it over to City Attorney Nick to talk through that a little bit with you and answer any questions that you might have. So, Steve?
Sure. Thank you.
Yeah, good evening.
Good evening. It is certainly a somber moment putting something like this before you, and I'm sure you share that seriousness of considering a resolution to declare an emergency in the city of Eau Claire. But know that this is a declaration that we are putting in front of you and recommending to you as an item of preparedness, something that is in the continuum of issues that Ms. Giese and Mr. Peters already spoke about putting a piece in place to prepare for certainly a health emergency that is underway in our nation and our state, but at least as of yet has real implications, of course, that people are already feeling in the community, but without any known positives has not, really fully hit us. But it's a legislative and a legal tool in your toolbox that I think the moment has arrived for you to consider. And what it allows is to further that preparation to provide for a flexible and timely response to an emergency that certainly calls for that, where things are changing at a very rapid level, and likely, again, will continue to do so when we start seeing cases locally. In terms then of what its foundation is, this is based on a document that we've had drafted, and honestly, I carry around in my briefcase and have happily not had to use for the last about 19 years after I listened to one of the attorneys from New York City say that carry one around within your briefcase all the time, because we had to write it on a piece of scrap paper, you know, type it off on a manual typewriter because of the circumstances on that terrible day. So it's a form and a basis that is there to use if needed. I have drafted it in a way that is specific to the COVID-19 virus outbreak. So the authority is under statute 32311. You also have local authority that is invoked in 2.8810, which indicates that in times of emergency, the city manager is declared the head of emergency government by action of the city council. It authorizes a number of emergency powers should they be necessary, things such as more timely procurement methods, procuring either personnel, facilities, goods to combat the emergency in various manners, again within the scope of local government services and existing budget. Modification of standards and procedures, ordinances, again at a local level, it's important to say. So again, we've had a number of questions over the last several weeks about changes that would take changes to state law or federal law, or even, on a call yesterday, things about, how could we change the election in ways that perhaps would underrepresent the vote and be contrary to one person, one vote constitutional principles. So we can't change those sort of things. We can only change things that are within our purview. So when Mr. Peters asked me that question earlier when we were drafting it, right behind Ms. Beaton, I still like to use at times printed books. So the blue bounded book is our Code of Ordinances. That's the one that's our purview, right? Those are standards that we set locally. Those are the types of things that under this order, if it makes good operational sense to make a case-by-case exception based on the exigencies of this emergency, the city manager would be empowered to do that. Noting it to you, noting that the change would only be, during the time of emergency. But those are the things we can change. The rest of those books, the other 5, I believe there are, that are all the state statutes, that's for the governor to change. So the purview is simply within our Code of Ordinances to make modifications as necessary. And the other key issue, really, Mr. Peters already touched on, is by our code, remote meetings, electronic meetings are prohibited in favor of in-person meetings for the more full, complete access by the public that the open meetings law prefers. But that open meeting law says the preference is the most open, accessible form of government, subject to the operational needs of the government, to paraphrase. So at this moment, based as the Attorney General Call recognizes, and as this resolution would recognize under our city ordinance, the scales are tipped a little bit, right? So we may have to tip those scales a little more in favor of having to get the work done in a way that, at least in the short term, isn't as open and accessible, and that we'd find as open and accessible a way to hold those meetings as possible, but recognizing that it still requires to get the necessary work of city government done during this time of emergency. But thankfully, there are a number of means to do that, and including live streaming these meetings to the extent they're still being held and recorded from this location, or them appearing on radio and charter TV, things like that, which allow the type of access which Attorney General Call references in his recently issued opinion. The final thing it does, again, recognizing the number that changed very rapidly from, some parts of the country from 500-person gatherings to 250 to 50 to 10 in a very short period of time, but certainly at its current status of 10. You have a number of special events that have already been approved by your legislative action during the pendency of this order, which would be through April 29th, or towards the end of April, those special events are canceled by this action, and that we would work with the event organizers, and Mr. Pippinger and his team have already outreached to those, both within that time frame and beyond, really, to work with them to try to reschedule dates. And we'd use the authority granted by this resolution for events that you have already approved, but on specific dates, but to move them to new dates that work operationally, both for those event organizers and for the city. So those are the primary effects. It has the ability to do things that are more in the statute, but I won't touch on those because, you know, by the grace and good fortune of the city, hopefully they won't come to pass. But those are the expectations of how they'll be utilized in the coming weeks under the order. And then the order does have a termination date of the end of the day on the 28th, namely a date chosen because you have a legislative session that day. So you could choose to extend it at that time, or you could choose to rescind it at any time, either at a scheduled meeting or a called special meeting, if those powers either aren't being exercised in the manner that you care to see, or if the emergency would no longer exist. Happy to answer any questions if I can.
Thank you, Mr. Nick. Any questions? Councilmember Gregor.
Yeah, thank you, President Weld. Mr. Nick, have any other communities passed resolutions of this nature?
A number of them have for the current coronavirus crisis, yes.
I guess, are there some examples that are, like, how recently did they do that? Just this week so far?
Yeah, the last weekend my listserv blew up with them. In Wisconsin, yeah. Yeah. Oshkosh, Milwaukee, Madison, I think, did it at a county level. We're doing it in coordination with Eau Claire County, so we'll be a city-county level kind of grouping.
Altoona, too.
Right.
Councilmember Beaton.
Do you know if a resolution like this has ever been passed in the city of Eau Claire?
I have not done historical research in the less than 24 hours that I've been thinking about and drafting this issue, but it's not happened in recent history. It certainly hasn't happened, since I've been here. We have had times of emergency, severe windstorms, severe flooding in the early 2000s. So we certainly had relatively large-scale community emergency responses, but I don't believe a formal declaration of emergency.
Not in the last 30 years.
Yeah.
Maybe 1980. I don't know. Maybe have to look that up.
Councilmember Worthman.
Thank you, Council President. Mr. Nick, I have two questions. I didn't read the code of ordinances that allows for this, but my question revolves around, I think it's 2.88.010. Are we taking the full authority that grants us in declaring an emergency? Like the full breadth of what it allows?
So, yes. Yes. And what 288.010, is that the one I think you had referenced? That's our city code, which indicates, to briefly paraphrase, that by city code, it's very short. I think it's just a sentence. It says the city manager is hereby appointed head of an emergency government, should it be necessary or something like that. Okay. And then references, although as I read 288, it references a former statutory code, but what it means to now reference would be 323.14, which enumerates the powers of local government should they invoke it in emergency government.
Thank you. And then the second one is just the scope of it. So here, this is a big thing, is temporarily modify or suspend a local ordinance. Mm-hmm. I assume that's the entire book, even charter ordinances as well, or how broad is that?
Right. It should be operated, and certainly my advice to the city manager will be, operated in furtherance of the emergency that we're facing. So I don't want to, kind of go through an enumeration of some of the issues, but they're operational. They're things that, again, given the exigencies, given the emergency conditions that exist, might need to have minor exceptions made. So certainly the point is to continue on to the extent possible. But if, again, if it makes sense in a short term to change, whether it's a code-based adopted employment benefit or a standard of how quickly someone is supposed to clear a sidewalk or something else, given that there's higher priorities currently, those would be the types of things that you'd be looking to do.
Thank you.
Any other questions from council? Councilmember Gregor.
Yeah, thank you, President Weld. I guess I'm looking at whereas clause number 4. There's the number 50 that's referred to statewide moratorium on a mass gathering of 50 people or more. Should we be changing that to 10, or what is your thought on that, given the state and recommendations?
My thought on it is that it furthers the point of whereas 1, which is a flexible and timely response as conditions change and additional data becomes available is all the more true. So, I mean, it just shows you how quick it changed from when I started drafting it to this moment. So those standards apply in terms of whether you'd care to amend it or not, but it was simply noting a then existing standard to say, hey, things are serious. And unfortunately, all that's happened is things have gotten more restrictive since. So I think it's fine as is.
Any other questions? Councilmember Berge.
I know, thanks for presenting this. I know Ms. Giese emailed you with some drafts. What are your thoughts on those? Because to be honest, I'm thinking about adding those in there. Because I know it was just kind of late, last minute type stuff. So what are your thoughts on?
Right. Yeah, some of the language was included in the first whereas. The other issue in terms of acknowledging incident command, incident command is through the health department, but this is a document that's giving authority to the city and goes in some ways dealing with issues that are really outside of incident command and invoke important statutory authority per our code of what the city manager has authority to do. So I think Mr. Peters was up here talking about the importance of incident command and working through it. However, also important for the city to recognize is there's issues specific to the city that, whether it's procurement for specific city issues, adjusting things to deal with human resources, our city codes, a whole number of things that may arise in this incident that aren't primary through incident command, and that each of the various jurisdictions are committed to that joint incident command, but each have their own distinct responsibility to their citizens to carry out the responsibilities through the city manager or through the county administrator or through the mayor and administrator in Altoona. And that doesn't lessen the importance of incident command or of the health department in responding to the overall health emergency. But it does indicate that each organization has its own responsibilities, and that, in our case, the city manager is ultimately responsible for those things.
Certainly.
So what I'm hearing is that you would not recommend for edits?
Correct. I would not, because it is true that there is that incident command. We intend to fully utilize it. Mr. Peters has certainly indicated that. I would endorse that. But again, there are other things outside of that, and this is a resolution that's in coordination with that, but is different from that, is uniquely a city piece of legislation authorizing the city manager to exercise his executive authority.
Councilmember Worth.
Thank you, Council President. If I could ask a follow-up on that. So just as an example, if Incident Command says we need X number more ventilating machines and beds and some space to put people who need care, critical care, and is Incident Command then turning to Mr. Peters and looking for resources that are city resources to do that, or how does that then get operationalized? And is this part of that gives him flexibility to operationalize Incident Command?
Well, with that example, those are resources that aren't available to the city. Right.
Or Incident Command asks for something.
Right.
To help us. Yeah, some service that helps us respond.
Right. Yeah, so something like make available buses as temporary shelters, or, fire department to arrive on scene, or PD arrive on scene, or any of the other things that are under the auspices of not only the city manager, but independent chiefs and department heads of the city of Eau Claire. Mm-hmm. And fundamentally those things are under the auspices of the city manager in the city of Eau Claire. Would they likely be denied if they can be provided to Incident Command? No. But mm-hmm. Who ultimately is responsible for them? The city manager.
Mm-hmm. Any other questions for Mr. Dick? Thank you very much.
Yeah, thank you.
So on a motion by Councilmember Berge and seconded by Councilmember Lohr, the resolution declaring an emergency in the city of Eau Claire is moved. Is there discussion? Council Vice President Emmanuel.
Thank you, Council President Weld. It seems that right now in this moment of history, pretty much everything seems insignificant except for coming together as leaders and community members to effectively try to minimize the spread of this disease. And I will certainly be in support of this tonight. If we look at the Department of Health and Human Services in Wisconsin, who at 2 p.m. every day posts updated disease rates, if we look at March 9th, we had 1 confirmed case in the state of Wisconsin. That has grown exponentially, and today, as of 2 p.m. on March 17th, there are now 72 confirmed cases in Wisconsin over many counties, including one that's not too far from Eau Claire in central Wisconsin. I think this is a responsible measure that we need to take to support our manager as he supports our entire city. I know that we are also not alone in entertaining this. Just today in my professional work, I received not 1, but 2 emails from the Counties Association from the state, where every county in Wisconsin in their municipalities will be looking at this. And so I think it's very important that we do this and do this promptly.
Thank you, Council Vice President Emmanuel. Any other discussion regarding the resolution? Councilmember Worthman.
Thank you, Council President. I would just like to offer a thank you to our city staff, city attorney, city manager, and the entire team of our city for the work that has already been done. And that's something that I think is important for us to be sharing in our community, is that this is a continuation of work that has already started for us to be responsive to this virus. And so I see tonight's resolution declaring an emergency, which I will support, as giving more flexibility and strengthening our response to this in an unprecedented time. It truly is. Again, I want to just again share my gratitude for the incredible hard work that our entire city organization, staff, and all of us are doing, pulling together to be responsive. So thank you.
Thank you, Councilmember Worthman. Any other discussion? Seeing none, clerk, please call the roll.
Councilmember Anderson.
Aye.
Beaton.
Aye.
Berge.
Aye.
Christofferson.
Aye.
Emmanuel.
Aye.
Gregert.
Aye.
Klinkhammer.
Aye.
Lohr.
Aye.
Weld.
Aye.
Worthman.
Aye. And that resolution passes. Moving on, Mr. Peters has a statement that he'd like to share to the community and to all of us. Mr. Peters.
Thank you, Council President Weld, and these are certainly unprecedented times, and if you would indulge me, I do have a statement following the passage of that resolution. And for the benefit of the community, we would like to, I'll read my statement, but then we'd also like to have it read in Hmong and in Spanish so that all members of the community can hear this. Our Eau Claire community works together. We help our neighbors, and we share a community pride of a better community, a better Eau Claire now and in the future. And today, the City of Eau Claire and Eau Claire County and the City of Altoona are working together to prepare for and address the spread of COVID-19. The city's emergency declaration supports the emergency preparedness and actions underway locally and those of Governor Evers and the state of Wisconsin. The City of Eau Claire emergency declaration that was just passed will be in effect through April 29th, 2020. And during this emergency declaration, special events scheduled prior to April 29th are going to be canceled. And we will work with the event organizers to get new dates for possibility. Also, remote attendance to city council meetings is authorized, and we'll be working to do that. And all non-essential board and committee meetings will be canceled. The city manager is then also authorized to take action that's necessary for the health, safety, welfare, and good order of the city. During this public health emergency, it's important to listen to and follow the advice of our health and other public officials and remain calm and with preparing personally and preparing the community for our response. The City County Health Department is our lead in joint local response, and it includes the city and the county and resources, but also our excellent local private healthcare organizations and their professionals. Please listen for regular updates and any directives from the City County Health Department, as it is the latest information to keep you and the community safe. Information will be updated every afternoon at 3:30 during the weekdays and on the City County Health Department website. Our vital city operations will also continue during this health emergency. Eau Claire will continue to provide basic services. We are implementing our contingency plans with fire and police and water, sewer, our 911 center, and the administrative support services while protecting our employees. The COVID-19 virus is a health, economic, and social challenge for our community and our country. This is a time to pull together, and as a community to address and face these difficult days ahead. We need to help each other, we need to reach out to our senior neighbors, and we need to find creative ways to support our economy. At the same time, it's important that we stay positive, active, and healthy. Social isolation can be very challenging. Please, as a community, be creative in how we reach out and care for one another. Stay personally connected with our neighbors and our loved ones, even during this time if we're unable to be, or that we are physically separated. Together, we will get through this. So with that, we've asked Councilmember Lohr to come up and read it in Hmong, and then Officer Gonzalez is going to come up and read it in Spanish.
Thank you, Mr. Lohr.
Thank you. Vấn đề chấp là hợp tác của trên mong nhớ rõ lên nó. Nu nó bé tàu công tê, lò pa, bé cháu nên nhớ chân trả trên tàu bé, cho lúc dây lúc rõ, ok. Cho lúc trong ngọc lên nó thì cho lúc năng giả tận tê. Nu nó bé họ rõ đến chia, cho ok không đi, thì lúc rõ ảo thứ nào. Bé công tê ok là chế cái thì thái tụ cam mò. Coven cổ chua nó bây giờ đi ở đây giờ ilu dây giờ tờ lão ba chân ga cháu khang thông nghị Evers nhớ rồi rằng sang Wisconsin khó chạy vô từ chỉ pu cho cộng trong đau cho cậu lăng một nhau kề do linh đó khó tôi cháu khang thông nghị Evers nó người tao là tặng chơi nó một sau lúc lâu thì vẫn thì cậu chua giờ bên mua tê cộng trong và tàu ba là vấn đề một giờ vẫn thì cậu cho lúc lâu thì áp hành ngầu nó cho nó bây giờ tàu mua cầu chê chỉ bút này chỉ tờ là chỉ bút này một con đâu liên đó bây giờ hậu lượng rồi cho còn trong nó còn là mua lu si hậu tận đây nó thâu lâu thì cậu chua nó mua mà cho lọc khi ta cá trộn này sẽ đỡ chỉ ta liên đó bây giờ City Council là giờ bây giờ trong sĩ thả bây giờ nhớ qua cả lọt thả hậu TV là sư giờ liên đó còn nói vậy khó chẳng chẳng tụ cam món nào tạo được bây giờ đâu bây giờ tổng ba thì thâu liên đó cho còn trong sĩ thả do hạt thì chỉ cho chẳng chẳng cho tới bây giờ một cầu chơi chỉ bù cho là sĩ thản gì là còn một sau lúc lâu thì cầu chua tao còn nói một bây giờ cho chạy cho bây tụi cho giờ tụi city manager nếu tao làm rồi chua hay thì có thứ chỉ nhau chơi cái là thì thay cam mỏ kinh gần cái nó cá hồ hú nhau cho bây lu dây lu giò nó có thông một món mông gần còn bây giờ còn không nó bây cho chạy cho nữa đâu liên đâu mu lu xí hở này vậy lu xí hở chẳng chẳng hàng tụi cam mỏ nó là bông được dây lu rồi bây lu dây lu giò lại cho liên đâu sợ đầu vô我写主写字啊但是做帮助làm lòng vì vậy họ chẳng chẳng được bây giờ nâng mong tôi liên đó mu bây giờ tuân rồi xua cho các món kinh kinh là do health department giờ cho là cho chơi chùa tụi các món là cho xua nu giờ liên đó bây trồng nhà trồng gì này chỉ幫到này ở đâu thì幫助ta làm lòng lo còn tiền đó bây chú xuân nu thầu bê mông bê châu bây giờ tàu là cái này thì muốn đã chịu chỉ giờ lên tàu này tàu thì bọn trẻ thiết chua bọn trẻ là giờ thì còn tiền đó bê sẽ đâu để thiết thay tàu từ các món nó giờ này sao bọn tàu chắc nó nên một chỗ họ bê lu website của thì City County Health Department lu website đâu lên tàu mu bê lu dây lu giò dây lu chẳng chẳng cho giờ thì bây mua cái nhiều xe ta chỉ nói là bây chẳng có hậu lực ba đồ lúc dây lúc gió nó xuất xuân hu chỗ này sẽ đào xuất tu bây giờ chế cái làm một ba cho tu tuổi là tờ tầm luôn cho sai đi thiết chùa y là giờ thì khó chờ mua cái sự chẳng là giờ bây giờ thằng hậu lực có mua cho cái chẳng có ba này xuất lúc sẽ hở tụi cam mò nói vậy khó, ở bên chơi sang trò, cái mò kinh kinh, để cái là lúa, là chỉ là bên lúa dây lúa giò khó cho cái nhiêu xe, thông bờ được mình cả tên nó, giờ lên đó bên chỉ nhỏ bên giờ tao là còn tên ok, lòn chia cho cái tí thái tụi cam mò nó, nhưng vì giờ lúa sữa này giờ lúa sữa nhiêu xe hàng đó bên sẽ đâu. Bây giờ tàu tờ ba bây giờ nâng chân dây được bên là bây giờ chọn nhà gì lâu của nhau dây chân chẳng được bên đó bây giờ tàu chế cho cái dòng một ba bây là lúa nhau họ lúa dây lúa giò nó họ đang vậy họ chỉnh chân còn dòng xe được bên tụi khăn thì ở đây dây lúa giò dòng xe thì bên tàu nhau được nó giờ giờ thì ta chỉ nó tờ nếu nó sao xử cho họ sẽ họ chơi là bây giờ chủ dòng xe tiền cho cái đi thay yêu tụ khăn là giờ bắt đầu tụi mình nhau thành dây để vui xa giờ lên tới nhon dòng hai tiền thì tôn thọ bây giờ đầu là giờ có cho thành cho dây nhau được co giờ lên tới có giờ chủ lúc của chủ lúc có bây còn tệ qua họ lừa ok giờ giờ thì bây lần nhảy khó là bây giờ tao còn tây là ok không thể hay khó chẳng chẳng giờ bây ok tụ cam món là bây giờ thì thái thì tất cả là thì thái tàu ô chào.
Thank you, Councilmember Lahr. Officer Rodriguez, appreciate you coming in.
Thank you.
Or Gonzalez, I'm sorry. I apologize.
You're fine, thank you.
I appreciate you waiting too. It's been a long night for you too.
Yeah, it's all good, no worries. Nuestra comunidad de Eau Claire trabaja y ayuda a sus vecinos y comparte un orgullo de comunidad de un mejor Eau Claire ahora y en el futuro. Hoy en día la ciudad de Eau Claire y el condado de Eau Claire y la ciudad de Altoona están trabajando juntos para prepararse y abordar la propagación del COVID-19. La declaración de emergencia de la ciudad apoya la preparación de emergencia y las acciones en curso localmente y las del gobernador Evers y del estado de Wisconsin. La declaración de emergencia de la ciudad está en vigor hasta el 29 de abril del 2020. Durante esta declaración de emergencia, los eventos especiales programados antes del 20 de abril del 2020 se cancelarán. Estamos trabajando con los organizadores de eventos para obtener nuevas fechas, si es posible. Se autoriza la asistencia remota a las reuniones y ayuntamientos. Todas las juntas no esenciales por el comité de la ciudad pueden ser canceladas. El gerente de la ciudad está autorizado a tomar las medidas necesarias para la salud, seguridad, bienestar y buen orden de la ciudad. Durante esta emergencia de salud pública es importante escuchar y seguir los consejos de nuestra salud y otros funcionarios públicos y mantener la calma mientras preparamos nuestras respuestas personales y comunitarias. El Departamento de Salud de la ciudad y del condado están liderando una respuesta local que incluye recursos de la ciudad y del condado, pero también nuestras excelentes organizaciones y profesionales de atención médicas local. Escuche las actualizaciones regulares y cualquier directiva del Departamento de Salud de la ciudad y del condado, ya que está la información más reciente para mantenerlos informados. Otras operaciones vitales en la ciudad también continuarán durante esta emergencia de salud. Eau Claire continuará presentando servicios básicos de la ciudad. Estamos implementando planes de contingencia para proporcionar servicios de bomberos, policía, agua, 911 y apoyo administrativo mientras protegemos a nuestros empleados. El virus COVID-19 es un desafío de salud, economía y social para nuestra comunidad y nuestro país. Es un momento para reunirse como comunidad para adobar y enfrentar estos días difíciles por delante. Ayúdense unos a otros, comuníquense con sus vecinos mayores de edad, encuentren maneras creativas para apoyar nuestra comunidad, manténganse positivos, activos y saludables. El aislamiento social puede ser un desafío. Sean creativos en la forma que se acercan y nos cuidemos a unos y a otros. Manténganse conectados personalmente con los vecinos y sus seres queridos. También debemos estar físicamente separados por un tiempo. Juntos superaremos esto.
Officer Gonzalez, thank you very much.
Thank you
for your service.
Thank you.
I would just like to share, if I could take a moment. I think we've all received emails and phone calls and messages from the community that are reaching out to us, asking how they can help and what they can do and what they can provide. And, you know, I just want to send the message that, you know, it's heard, it's appreciated, and it's not surprising that this community would be such that, you know, they would offer those things, because we are a caring community, and I trust and believe that. We know it's a difficult time. We know it's an emotional time, a time when we want to hug our kids every day and you know, keep pushing on and know the community of Eau Claire and our staff and everyone else that we're going to work as hard as we possibly can. I'm certain of that, both council members, as city staff, as a community. I mean, we are all pulling together, and it just makes us stronger and makes us feel, that unity and that ability to be proud of who we are and what we are. And I know that that'll continue. And to those that have reached out to us, all I can say right now is keep reaching out and reaching out to other organizations, to your neighbors. Find a way that you can give and support this community until we can have a chance to better organize and help you find that place that you can help support. So with that, I will allow, if council members have anything else they wish to share, please do so. Otherwise, we'll move on. Any other comments from council? Thank you to all the work and staff and to our county health department and to all those that help make this possible. So to council and to staff, we do have some individual personalized pizzas that if you are hungry, they got here at 6:15, so I assume they're still warm. So, but pardon? Yes. Process. The goal tonight was to discuss the proposals that were submitted. We had 8 proposals, and council was tasked with scoring those proposals with the hope of either narrowing it down to 1 or 2 or 3 or 4 or however many, and then proceeding from there. So I guess at least, and I did email all of you in regards to this and spoken with staff, and I would like to at least bring up the discussion, and again, just a discussion at this point of putting a pause on this process for obvious reasons. And I think our community is looking to us to use the time that we do have available to serve their needs, and I think that's owed to them, our full attention. And so, although this is an important part of our job, I think at this point we need to prioritize our efforts and our work. So, thank you. I can leave it at that for right now and allow you the opportunity to discuss. I would like to at least make one more comment. We have started this work, and so the first process anyway, and if it's council's decision to at least see it to the end of this process as far as selecting a consultant, that is an option. If we wish to just put a pause and ask everyone that did submit, the opportunity to delay our decision 90 days or however many days, that is another option. We can narrow it down to 1. We can select someone. We can, like I said, narrow it down to however many. But knowing that there's, a wide variety of options, I'll leave it at that. So. And I just would like to open up the floor, if that's okay, just for time's sake, and feel free to speak. Thank you.
Thank you, Council President Weld. And I appreciate just opening up the door for conversation. I think this is, if you would have asked me 2 weeks ago, what's the most important job of the City Council, and that would be to find the new city manager, but that is not the most important job of the City Council anymore, for now. I think my preference would be that we would go ahead and give direction to Mr. Bovee to reach out to the top applicants, the successful people who we ranked, to ask them for either a 90 or a 120-day extension. And then I think, and I know the city manager is here, just to make sure we're in close communication of the sensitive nature of, potential retirement, whether that date changes or is extended, so that we have adequate time to either bring on an interim to help with transition of continuity of leadership through the public health crisis. And the last is, I don't think it's beneficial for us today to even narrow this down to one firm, because we don't know what's going to happen with that firm, if they're still going to be in business. So I think it's best to just suspend it all. We'll pick it up when we need to and ask the city manager to be in contact with us, which we know he will be, on do we need to help support him and any change of leadership pending retirement.
Thank you, Council Vice President. Councilmember Klinkhammer.
I would say that the only reason for delaying would be if the required travel becomes virtually impossible. I think, yeah, we've got we've got other important issues that we're confronting now that we didn't anticipate a couple months ago, but we're here to lead this community. We're here to fulfill our responsibilities, and one of them is to replace our city manager. And I think once we've started this, we have to show that we're capable of doing it, and I think we can. But if travel prevents us from effectively communicating with these people the way that we want to, then I'd say wait.
Councilmember Christopherson.
Thank you, Council President Weld. I'm always appreciative of the conversation at the council table. My first point would be, I feel at least ready to have a conversation about what I read and what's available, and see if we have some point at which we merge what our desires are in this. It never occurred to me that somebody would not still be in business at the end of this pandemic, but that's a real possibility. So the conversation, having just read all of these and done my work, would be helpful to me. The other piece that I would feel that I would like to have some direction on, or a sense of closure tonight, would be, if we're going to postpone the search, I would like to know if there's openness to Mr. Peters also being open-ended with his desire to retire on time, so that we are, I can't imagine anything more disruptive than to have transitional leadership at a time when this would be the worst time to have transitional leadership. It's disrespectful to that person who's taking on a new job. It's I think it's less than what we could give to the city. So I'd like to have all of those thoughts on the table as part of the same decision. I'm fine to postpone, but that would be my least preference.
Councilmember Worthman.
Thank you, Council President Weld. Just to add to this conversation, I think there's a number of different barriers that we will run into, and just a few that come to mind are the fact that we are asking for someone to potentially move their family and come from a different city where they are probably in leadership there, responding to a very critical incident. We may get a different applicant pool if we're looking for a new city manager, given the state of our national our national response to this. So that's one piece of it. I think a second piece of it is that the firms that are on this list, their capacity may be changed by working from home, not having the same sort of access to facilities that they normally do. So I don't know that we're getting, if we select one of these tonight, but we delay our request for 90 days, I don't think we understand fully what that could look like and whether they will have that capacity. Not to mention the travel piece of this, not to mention on top of that, our ability to be as transparent and open with the public given this time, because we want to make sure that we are engaging the community in this decision. So I just see a whole number of hurdles that make this challenging. And I think the biggest one is finding on top of transitioning leadership at this time in our city with Mr. Peters, but I think also searching nationwide right now for good candidates is going to be a huge challenge. So for those reasons, I think it makes sense for us to postpone however we can, however we do that.
Thank you, Councilmember Worthman. Councilmember Anderson.
Thank you. I also think that postponing makes a lot of sense. I think it's best to approach a process like this that involves meeting a new person who is going to experience a lot of curiosity and openness about our community, to avoid doing that in a time when most people are focused on the present and on the sort of anxiety of the moment. It would make more sense to wait until whoever is probably currently working as a city manager in their community feels like they could begin to look up from their workload and think about, oh, what are my career next steps? I think probably the applicant pool that we would want would be people that are really focused on their communities at this point in time. So it makes sense to me to wait.
Thank you, Councilmember Anderson. Councilmember Beaton.
Thank you. I also feel like the decision to postpone this is crystal clear to me. I agree with everything that's been said. And I also just want to add that, that though this is the work of the City Council, there's not zero work associated with this for our staff, and I know that their main priority, as it should be, is dealing with this crisis right now, and I wouldn't want to take 1 second away from that work to devote to this. I wonder if it would be appropriate to invite City Manager Peters up to the podium to address some of the questions that we have around his retirement.
Sure.
Since that's been addressed twice so far.
Can I just see if there's any other comments or questions first? And Councilmember Lohr.
Okay.
Yeah, 6 feet, 6 feet.
I also agree for the postpone to delay. I think that right now we have the virus going on, and I don't think that is a good idea to rush for the city manager to searching at this point. I think that we as a council and our colleagues and body working together, I think we need to slow down and find an effective way of searching the city managers. And I think that when we take time, we'll find better solutions at the end. We rush. I think that we will be struggling at working at the community right now that we talking early that we will not be able to meet face to face. And these are a challenge for us. And at the same time, if we have a new recruiting city manager, we need to meet him or her face to face and talk to he or his or her prior to the final decision of the council as body. So I agree. Crystal clear that we need to slow down and take time.
Thank you, Councilmember Lohr. Councilmember Berge.
Yeah. Get my steps in.
So I also agree about not picking someone right now or controlling that. But I am open to picking or narrowing down a firm just because we have put in the work, staff has put in the work. It's fresh in my brain, as council colleague said over there too. So I don't know if we'd have to redo that work, which I'm fine with doing, but if staff needs to redo that work, they've already put in the work now. So where I don't think it's appropriate to actually search for a city manager, but if we could, I would be open to narrowing down or even highlighting if it's easy. I don't know if it's easy or not, but picking the top one kind of rose to the top. But so that's my comment.
Thank you, Councilmember Berge. Councilmember Klinkhammer.
I didn't mean to drop my glasses. I'll rethink my statement earlier. I think that comment that Councilmember Worthman made. I think it's important for the city, for us, for the city to have the best chance at the best candidate, and I think that the conditions in the country right now may prevent that. But I also agree with Councilmember Berge about, I think we should, if we're going to narrow it to a short list or to one, as long as we put this time in and the staff has put the time in, maybe it would be better to select that group or that one and then work closely with them to position ourselves at some point, 90 or 120 days, whatever is appropriate going forward.
Thank you, Councilmember Klinkhammer. Councilmember Beaton.
Yeah, I think that I'd be prepared to have a discussion about this today. I think I'd be prepared to even make a decision that maybe we could, I don't know if it's possible to notify the consultant and let them know that council had made their decision, but we're going to be postponing our action with this. I think it'd be good to have to make that decision and hope that, you know, nobody goes out of business in the next couple months. I feel that the best time to make that decision is now, having just put in the work. And I think if we're going to wait, we should be prepared to do that work again.
Any other comments before I bring Mr. Peters up to at least answer your question as he sees fit? Council Vice President Emanuel.
Thank you, Council President Weld. I think in addition to if Mr. Peters is comfortable sharing, which I would also understand, I mean, this is like an employment decision, so I want to be sensitive to that. But just a little bit on the mechanics of the feasibility of extending the kind of the RFP window from Mr. Bovee as you deem appropriate
Sure.
to answer those questions.
Yep. Mr. Bovee or Dale or Greg, either one of you want to? Okay.
Yes.
So maybe just a couple of comments on the different scenarios that have been discussed.
Yeah, I certainly see some of the challenges of hiring a firm today. We would have the ability, if you wanted to pare down to 3 or 4 or 2 or even 1, that might be a little bit more difficult to pare down. We can certainly communicate that to the firms that we're either pausing it if we get it to 3 or 4, or if we do get it down to 1, be able to communicate with them that they're the selected firm. We wouldn't have to contract with them. Clearly, we would have to work out a revised timeline based on when we want them to start the search and when we'd expect them to complete it, and we could work that out. And then as we got to the point where we wanted to jumpstart the process, could contract with them at that point. So you wouldn't have to, I guess, put ourselves in a position of, you know, if they do go out of business or anything like that. So we have that opportunity. So I mean, we can be as flexible as we want. We could certainly, you know, all the scenarios that were presented, we have the ability to be able to do that. So,
questions from Councilmember Beaton?
Would you have a preference of us making a final decision today, or just paring down to a smaller group of candidates?
it depends on how deep you get into the conversations. As you start going back and forth, it could be evident that there's one firm that everybody has on the top of their list, or it could muddle things a little bit. I certainly see you could get to 3 or 4 firms probably pretty easily. From there, the top 1 or 2 is a little bit more challenging.
Okay.
So.
Council Vice President.
Thank you, Council President Weld. I haven't been a part of public negotiations over a search firm, so it feels a little bit like we're picking my experience on picking an employee in a search process, and to be doing that publicly, to say, well, these are the firms that we're going to disqualify essentially or exclude from the search, then knowing when our search resumes, we may or may not have, let's say we narrow it down to 4 firms,
maybe 2 are available, but if we've already told the other 2 or 4 down below, we're not interested, but now we only have 2, are we interested in moving up the other firm? So, I mean, do you, I don't mean this in any way like to ask you to take a position on the direction that council goes, so I want to be very clear about that. Are there logistical issues that might put us in a box that we didn't intend if indeed we, for lack of better words, disqualify a firm or remove a firm from our consideration?
The only thing is if we did shortlist the group of firms and we tried to reintroduce somebody that was not shortlisted, you could get one of the other firms to protest the process, particularly if they weren't chosen. That's a real possibility. Doesn't mean that we couldn't do it. We just have to. I certainly would have to document the reasons and have good, clear, and compelling reasons that we did that. There are some that exist, obviously, in the environment we're in as of the last couple of weeks, but that's a real possibility.
Councilmember Klinkhammer.
If we paused this process and picked it up again in 90 or 120 days, would it put us and you and your staff in a better position to just leave it at that? I mean, not go any farther in terms of making a short list or picking one now?
Yeah, I don't think it puts us in any worse position at all to pause it and pick it up. It's not like a construction project where we may have to deal with inflation or materials costs or anything. I think the costs are going to be pretty well fixed. I think it may give us a fresh perspective. I mean, there's a lot of things on everyone's mind right now. Not that this is trivial by any means, but it's certainly less pressing. And we could put a pause. We could tell the firms 90 days, but if the landscape is different in 30 or 45, contact them, reinitiate the process, and start from there. So, again, as flexible as we want to be.
Any other questions for Mr. Bowie? Thank you.
Thank you.
I'm sure there'll be more. Mr. Peters.
Tough conversation. These are truly unprecedented times. And I know you all know that there's a dedication and passion about the well-being of the city and the organization. And of course, retirement's a very personal decision, and I fully recognize the impact on the organization. Quite frankly, things have been moving so fast. I have not internalized that question or discussed it in any meaningful way with my family. And I certainly understand the concerns about the recruitment and the timing of it and many of the comments that were made. And although it's not directly expressed, I guess I'm interpreting the fact that I'm standing here that you're asking me to consider extending my retirement date. That's a fair question. What I would like is a little time to consider that and discuss it with my family. I guess I would commit to providing you some feedback on that sometime next week, if that could work for you.
Certainly.
Thank
Council
you.
Vice President.
Thank you very much. Thank you, Mr. Peters, and I realize the very delicate nature of even having such a public conversation around somebody's professional career and employment, so I appreciate that. I don't know that council, and obviously I'm speaking on my behalf, I don't know that there's necessarily a message of please do or don't extend. I would say for myself,
would I have greater assurance if you were here longer? Absolutely, 100%, more than 100%. Would I be completely understanding if you decided to keep your retirement near or same, you know, what you were planning on? I would more than 100% support you. And what I would ask for, and what I feel like I need as a council member, is adequate time to know what that plan is, so then council will have time to name an interim and allow for that person to rise up in their information and knowledge so that they can successfully take that baton. And I know you would have done that anyway, so I'm just speaking for myself. That would be my preference, is to support you in whatever you decide wholeheartedly, and that we have a smooth transitional plan through this public health crisis.
Understood, and yeah, I understand.
Councilmember Berge.
I just want to say, Mr. City Manager, that you need to do what's best for you. That's what I feel, like what's best for you and your family. And we're going to be okay, because we have a great staff, we have a great council, we have a great community, so, and you're still going to be around, right? Like,
yeah,
you're going to be
that's
stuck
true.
in your house, but you'll still be around. So I just want you to do what's best for you. That's me being me, I guess, but.
Okay. All right. I do understand and respect the need for you to have information to be able to make decisions on, so I'll provide you some information and feedback.
Thank you. Councilmember Lahr.
Mr. Peter, I think that losing you a professional, we are struggling into this community, and I appreciate that you take your time to think about it and consider that you can extend your retirement. I personally would like to see that happening, because as of now that we struggle finding a new city manager. This community is, you are the person who lead this community along with the council together. So I wanted to encourage you and do the best you think that will fit your family, but I also miss that if you didn't be able to extend your time, that help us to guide to this community, and at the same time that right now we are struggling for many reasons as the virus coming in town. We are searching for a person to replace your professional. These are things that worry this community a lot. So just for you to know that we are thinking about it too.
Okay, thank you.
Any other questions for Dale? Mr. Peters. Thank you.
All right, thank you.
Yeah. All right, so I guess back to the discussion again.
I move that we postpone the process and direct Mr. Bowie to contact the companies and inform them of such, and that we'll be picking it up again at 90 or 120 days. 90 days.
Not to exceed.
Yes.
It could be less than that.
Unless we extend it.
Okay, so we have a motion to postpone for no more than 90 days unless directed by council to go less than that or extend it. Is there a second? Councilmember Christopherson is seconded. City Manager Peters.
Jump in on Mr. Bowie, but are you also asking for direction that we ask the vendors to hold their pricing through that 90 days, or are we letting that go and starting over? So just to be clear, it's just so we're clear, you know, in your direction.
Go ahead, Councilmember Klinkhammer.
Is it inappropriate to ask them to hold it, or is it, are we better served to let them?
No, I would, my expectation was to ask them to hold their pricing as
Very
well.
good.
Yep, that's understandable.
I'll accept that as a friendly.
We have a motion and a second. Is there any discussion? Seeing none, clerk, please call the roll.
Councilmember Beaton? Aye. Berge?
Aye.
Christopherson?
Aye.
Emmanuel?
Aye.
Gregert?
Aye.
Klinkhammer?
Aye.
Lohr?
Aye.
Weld?
Aye.
Worthman?
Aye.
Anderson?
And that motion passes. Any other discussion that we need to, I guess the survey is out there. It could certainly remain, and I'll allow Ms. Selton to speak to that and see where you want to do or go with that.
So as the city manager mentioned in the Friday update, the survey's out there in electronic form and paper form at various locations. I did check today to see where we stood with respect to the number of responses. And on the Polco survey, the community input, we have 68 responses to date. And then the SurveyMonkey, which is the survey that the staff are completing, we have 91 responses. So what we can do is we can extend the survey longer. Right now it's set to end on Sunday, but we can extend it if that's council's desire.
So we say to the end of the month. You want to go the term of the, I'm guessing it, go ahead.
Thank you. I would say either 30 or 60 days. One advantage of a lot of people telecommuting is we're all trying to find new things or get to the stuff we haven't gotten to yet that we should have. And either 30 or 60 days, that would allow staff time, at least another 30 days before the search firm may start. So, Mr. Klinkhammer.
Councilmember Klinkhammer.
Thank you. I was just thinking, maybe it would be appropriate to extend it, the term of the emergency.
Certainly, that's a good idea.
April 29th. Because, I mean, we're asking extra things of our staff now and our employees. So it would make sense to give them that extra time to coincide with that.
Sure. Any other discussion or thoughts on that? Anyone opposed to going till April 29th? I don't know if we need to vote on this, right? All right, well, we'll extend it out to April 29th, and I guess obviously we can make changes if needed. Any other discussion in regards to the RFPs or the process of city manager replacement? All right, seeing none, if there is no objection from council, certainly, yeah. I'm sorry, we should go back to the agenda and talk about next week. Is that your question? So we are scheduled next week, and as Dale mentioned, we still, aren't sure of anything looking ahead. If there is not really much need to discuss the RFPs or the process, you want to put a pause on the work session for next Tuesday? We would still have our public hearing on Monday and our legislative session on Tuesday unless things change. But in regards to the work session, which was going to follow that legislative session, we will cancel. Okay. Yeah, I guess it just depends on where we go. I mean, we do have CIP work sessions and others coming ahead, but yeah. Right, regarding the search, sure. We can, I don't know if we've scheduled any others moving forward, but we can cancel those.
I think
Any
it seems
other business? Go ahead.
We could come up with a new schedule for a meeting schedule after the 90 days that we take up the RFP selection.
Sure.
I think it's probably good not to have to think too much about this until then.
Sure. Anything else? Councilmember Gray here.
Yeah, thank you, President Weld. I guess it's another workload issue for staff, but since we don't have any media here, it would probably be good to get some sort of press release out. Oh, we do. I'm sorry.
Ryan's back here.
Oh.
We're going to filling in for Andrew Dowd.
Sorry, I can't see you back there. Well, it would probably also be a good idea just for a competitive media landscape, maybe, to do a press release about just the delay of the manager search. I'm not sure. Yeah.
That's their issue. I think it's a good idea. I'll get that out tomorrow.
Anything else? Anything else? If there is no objection, we are adjourned. Thank you.
This program was brought to you by